Welcome to the show, everybody. Micah with Coronavirus Diaries. Today, I'm fortunate enough to speak again with Gabrielle Arrowsmith, a health unit coordinator in a pediatric unit here in Minneapolis. I wanted to say Gabby, but I know you don't like to go. So, Gabrielle, how are you?
I'm good. How are you?
I'm doing great. So, the last time we had spoke, there was talk of a potential furlough.
hmm
What ended up happening?
Well, it was a pretty intense 2 weeks. So we knew we were going to have a lot of furloughs within our department. So our supervisors ended up speaking to each modality or each area within the department about how many staff members would be furloughed and gave everybody an opportunity to kind of look into numbers, get their finances in order to see whether or not that would be the best choice versus remaining at the hospital with reduced hours and reduced wage. And
Sure.
then they took the option for people to volunteer to furlough. So there were a lot of people who volunteered to furlough. In my area, none of us volunteered to furlough. So I assumed since I was the least senior, don't have the seniority that it would be me. And I was right. And I found that out on Monday, and my last day was Wednesday.
So, what are your thoughts? How do you feel about the whole thing?
It's tough because I think last year end, our hospital published something saying that we had 240 days cash on hand. So I think at this point, a lot of staff members, a lot of employees have been saying, you published this saying we had this much cash on hand and things are starting to look like they might turn around here. We see other countries and other states starting to initiate an exit plan to kind of not be locked down anymore. And we are
Sure.
also seeing our numbers rise. They're definitely not what they were when we were determined low needs. So it seems kind of strange for our organization to continue with furlough at this point as we see numbers rise, knowing that they have cash on hand. That's what they've published in the past. I really do think the hospital systems are going to recover. As we're not seeing this just in pediatric hospitals. I know other hospital systems are also having the same issue where they've been losing money because patients haven't been coming in for fear of, the
Right.
fact that hospitals are treating corona and they just don't want to increase their exposure.
So I think right now the last numbers that I'd seen, it was around 260 or something deaths in Minnesota. And I tend not to lean too heavily on infection rate because that would require the entire population getting tested within a short amount of time, and that's just
hmm
not happening. In terms of the mortality rate, the fatality rate that's happening, what does it look like, or what did it look like when you were at your hospital? Did you see any indications that that there was COVID even happening in the hospital, or
Most of the indications that we saw were the precautions that we were taking as staff. Everybody being masked, both employees and visitors to the hospital being masked. The different areas, like we had set up physical kind of barricades, like partial walls in our
sure?
welcome area so that anybody who had symptoms would be pre-screened and then moved into that separate area. So we saw a lot of those kinds of things happening. As far as the numbers of people coming into the hospital with COVID, obviously it's going to be more than what it's ever been because this is new, but
Right.
it wasn't more than I guess than anything that we were expecting. We were very able to handle the amount of people that were coming into our hospital with flu-like symptoms.
Sure. Well, it's really interesting. I know right now all across the country there's it's very divisive. I think everybody's kind of seeing um, what's happening in media in terms of protests and rallies. And um, it was last weekend actually, I had gone out and documented a rally that had happened nearby me at the governor's mansion. There was
hmm
a number of healthcare workers that had come out. They had donned masks, they were in their scrubs, and I had the chance to talk with them briefly before they came out, and it just sounded like um, that there's definitely a divide between people that just, one, don't even think masks are necessary, don't think COVID's even real in some cases, and then there's the other side of the argument and debate that is, they understand it to be real and they understand the need for certain precautions. Are you noticing any sort of divide that's happening within healthcare itself? Are there healthcare workers that are actually opposing lockdowns, opposing people wearing masks in public? Is there any of that?
No, I guess I haven't really seen much of a divide. I think in healthcare, you'll find most people kind of united on the one side of the argument that we need to be really precautious. I do think that there are those who maybe don't think that the measures that have been taken so far are still the best choice, but I guess I'm not seeing like a clear divide or much tension between people who have different philosophies on this.
Okay, so everybody that's at least within healthcare, everybody's kind of joined arms in sorts to just kind of push through it and figure it out as they
Yeah.
go.
Yeah. At the same time, I mean, it's been a long road already, and we know there's a long way to go. So you're definitely seeing that from folks, and everybody wants things to be back to normal. But I think in healthcare, we're seeing most people wanting to be cautious.
Err on the side of caution.
Yes.
Right.
Yeah.
Yeah. The news and the images that came out of Italy and Spain were a little bit disturbing to see what kind of the tipping point once the healthcare system is. Once it starts collapsing, it's not just COVID patients or, that are dying, it's other people that can't get the care that they need. So it'll be interesting to see what happens with numbers post all of this, whether that's in a few months from now or, a year or more. Did they give you any kind of a timeline, or did they talk to you about the potential of if numbers rise significantly, they'll pull you into like assist or do anything like that?
Yes and no. That has been something that our hospital as an organization has stated. They've sort of said, this is the plan. We're doing wage cuts all the way through December. So that's the timeline.
Wow.
to December 25th is when our normal wage will come back. And then the furlough period is through August 21st. So almost 4 months.
Okay.
Yeah, so the organization has stated that if there are changes, these things might change. I, as an individual, tend to think that once this information has been given to us, I think the organization is, they find it important to, make sure that their income is what it has always been. And I think
Sure.
it's going to take quite a lot of change for them to take away those things that they've already instituted.
Sure. So I was in a discussion with some folks the other day, and someone had made a comment that they believe hospitals are receiving additional funds federally for every case diagnosed. Have you heard anything about this? Is there any sort of talk about cash flow in regards to COVID-19
No,
diagnoses?
I have not heard anything like that within our hospital for anything associated with a COVID diagnosis.
Okay.
We definitely have received some federal support, but not in association with patients who have been diagnosed.
Is it kind of similar in regards to like the small business loans or the federal assistance that's just going out, the $2 trillion package that just got deployed all over the place?
Mm-hmm.
Yeah.
Yeah.
Well, it's interesting. I appreciate you sharing that.
Mm-hmm.
So 4 months, you're looking at roughly 4 months.
My situation is a little different just because there is someone in my area who's going to be out on paternity leave.
Huh?
So
Okay.
for me, it's likely to be a little over 2 months. Then I will come back for 4 weeks. And then it's uncertain after that whether I'll just stay on, if I'm going to be re-furloughed, if they're going to ask that individual to do like a health-related leave of absence to try to extend his paternity. We're not quite sure what's going to happen at that point.
And is this
which
kind
I know
of...
has been, it's been really frustrating for people who are expecting, moms and dads, because they haven't been able to get the answers that they're looking for, and they're needing to make decisions for their families based on, information that's not available. And they would just keep saying, we don't have that information yet.
Yeah, I can only imagine. I couldn't imagine bringing a kid into the world right now. It's significant. So power, respect to anybody that's doing that. Regarding the information that's being shared, do you think that's simply because there's an understanding that in a month from now, numbers and information and data could be drastically different than we know currently? Or is it just is that just kind of the status quo for how your leadership disseminates information.
Yeah, I think that's just kind of the status quo for how they are doing things right now. Just trying to, and it seemed to be the same with the furlough. I know that our managers and supervisors had come up with a plan. They had selected individuals. They had submitted that plan to people higher up the chain than them for approval, but yet they didn't tell us. They just wanted to, wait to the last moment because they knew some people might be upset, and
Yeah,
they didn't want anything to change and have misinformation out there. So I think a lot of leadership right now are choosing to communicate things until the last possible moment so that change is less likely and frustrations don't happen.
sure. The amount of information that's circulating is daunting to say the least, and it's
Mhm.
the more you start to dig into it, the more difficult almost it gets to start uh, making sense out of all of it. Well, in regards, so now you're on furlough. You
Yes.
have a side project that you've mentioned,
Mhm.
because you also you have a creative side to you. You might share a little bit of that, like what's going on?
Sure. Yeah. It's going to be great because for me, I'm used to doing the creative stuff on a very limited amount of time that I have available with my full-time job and my part-time job. Now that those are not existing, I'm able to kind of focus on some things creatively that have been on the back burner. And I think I'm seeing a lot of creatives doing that right now in order to keep exercising their skills and whatnot. They're trying to kind of work on these passion projects. So a friend, his name is Nick Hansen. He is going to be directing a film based on Hamlet. So it's going to be Hamlet 2020,
Right on.
set in modern times, set in the COVID era, if you will. And then the characters are still going to have that Shakespearean language, but everything else is going to be modern, the way that we dress, our
Sure.
settings that we're in. And it's all going to, a lot of it's going to be done over a platform like this,
Yeah.
technology, and some like interesting, if you've seen any of those sports videos of kids like passing a ball to all their teammates and their families like kind of cut it together,
Sure.
we're going to try to do things like that where we're using props that would be in the normal play, using those same props, and then passing it between screens, if you will, in the edit.
That sounds really cool. It'll be
Yeah.
interesting to see what ends up coming to fruition.
Yes.
What is there a like? What does a project like this consist of? How many people? How long does something like this take to film, and then the post production side of things? Is there an anticipated date or a film fest or something that you're trying to get it into?
No, I don't think they have any specific deadline for a fest or anything else in mind right now. I think we just want to be as productive as we can during this time because I think we're all very aware that as soon as things do start to open back up, everybody is going to be really busy focusing on those areas of life. So
Yeah.
it makes a lot of sense to kind of just pack this in right now. So we've been doing a lot of like just rehearsal sessions like this, through use of technology, preparation. And I think we're looking to start filming later this
Outstanding.
weekend or early next week.
Well, it'll be really interesting to see what happens with this, and you'll have to keep us in the loop as it progresses. Um,
Mhm.
so I know we're getting kind of close to the time mark. Was there anything that you were interested in sharing or touching base on that we didn't get to briefly?
Just one other thing about the hospital system right now is one things that our managers and supervisors were kind of forced into doing is they had to make a lot of tough decisions. We're seeing that in all kinds of different organizations, not just healthcare.
Sure.
Um, a lot of people in leadership roles are making a lot of really difficult decisions right now, and our managers did a good job of like coming around to each area and telling them, look, like even if things change, we don't necessarily think we're given a certain amount of money that have available and money that we have to make up the rest of this period, and so we don't anticipate like bringing anybody back for support. So as needs increase and perhaps even are more than what we're used to seeing, more than what's typical, because so many people have not been coming to the doctor and putting things off,
Right.
that we think we might see kind of a surge once things start opening back up. And
Sure.
they've basically given everybody a pep talk and said, don't expect to have any additional support, even though you're going to be working with reduced staff, with a higher patient load than what you've ever been used to. So it's kind of
Well,
scary when you think about like patient first care and, mistakes that could be made if staff are really, really overwhelmed.
Sure.
So it's just unfortunate right now that the financial state has put organizations, not just hospitals, but many organizations in the position to not be able to do their best work.
Yeah, there's a lot of growing pains that are happening right now. I think, locally and nationally and even internationally in terms of policies and procedures. And something like COVID comes along, and then it shines a big light on, just the capabilities and the preparedness, really, in many aspects. Kind of like you were talking about with the hospital. It's really interesting that they would say, we have 230 days of financing to allow us to, kind of navigate
Right.
what's happening in the world.
In an emergency situation, which we're in.
Yeah. And I'm wondering if maybe something like with that, they took that number, they said 230 days. I think it was the Center of Health. I can't give a specific. So there's, I'm blanking on the name. I wish I had it off the top of my mind. They had created a handout for the lawmakers to discuss how long to be anticipating a pandemic to last, and they had set it 18 plus months. Mm-hmm. So I'm wondering if leadership within a business or a hospital in this case looked at that and said, okay, we've got at least 18 months that we need to be able to manage. We need to start cutting costs now to extend that 230 days. Maybe that is a path.
It could be part of it. I also know that, we've had a lot of really good meetings with FAQs, with general employees could, write in questions and whatnot, which they've been good about answering. And it sounds like there's also just a lot of red tape. It's amazing, even in this kind of situation where it's like, well, these bonds can't be accessed unless this happens, and this grant can't be used in this way. It can only be used for supplies, not employee funds. Like, it's just very interesting, all of the red tape that is involved.
Well, that's an entirely, that sounds like a documentary in the making right there. Red tape, what's it all about? Well, I really appreciate your time, Gabrielle. It's really great to be able to hear it from a healthcare worker, kind of just a little bit of better understanding. I can go and read all that I want online, but to actually hear it from somebody that was there and lives it is really appreciated. So thank you for coming on the show.
Thanks for having me.
So for all the viewers and listeners, I hope you enjoyed, and stick around. We're going to have more of this coming your way here in the near future.